Let me ask you a little bit about distribution here in the United States. We're a federal system. I mean, state governments, local governments have lots of different authorities. What can we do in the near term that will start to make a meaningful difference in the effectiveness of vaccine distribution in the U.S.?
I'm running vaccine distribution right now with a team of people and a partnership I put together at Gillette Stadium, Fenway Park, and beyond. And what I can tell you is, number one, it's getting clear explanation of how much vaccine is coming. You know, the situation until just recently was that you had people signing up for slots and then no certainty that the vaccine would be there, and either the slots would have to be canceled or the slots would suddenly open up magically overnight because you didn't have the plans in place. That is the biggest thing that needs to change right now, is getting much better predictability about how much vaccine is coming.
And do you feel comfortable this idea that the Pentagon might actually provide troops with FEMA for vaccination centers across the country? Is that something that we are, well trained, well capable of actually doing and not stepping on the feet of the existing distribution plans that we have in place?
I've also been involved in scaling mass testing, and I can tell you the National Guard was absolutely critical in being able to get to hotspots and deploy testing to know where things were running out of control in nursing homes and in many communities. The National Guard can be a vital element for driving staffing. Also, what we've seen is just changing the rules, that you don't have to have nurse or paramedic level people required to give vaccination. In my state and many others, you have seen that they've allowed basic EMTs to be able to provide the vaccines, pharmacy technicians, and I think we can get to the point where well-trained lay people could eventually be able to provide these vaccines as well with the right supervision.
So if you think about the billions and billions of dollars that are now being invested in everything from the vaccines themselves to health preparedness to emergency response, what are the things that you think will change in a dramatic way as a consequence of coronavirus in how we think about health and disaster response?
Again and again, our health system has demonstrated what we've seen over the last year, which is that we're all breakthrough and no follow-through. There are major gaps in our ability to make sure that Americans get the basic capabilities that assure people their, your 80 plus years that you can have if you have the appropriate access to diagnostics and treatment and ability to afford them. So I think what we're discovering is the basic public health precepts that apply in this pandemic. Why can't we get testing? Why can't we get the vaccinations distributed? Applies to the fact that we have a third of our counties that also don't have obstetricians and obstetrics units, that even more don't have inpatient psychiatric beds. We have massive problems with lack of access to the key things that make a difference in people's lives, problems in making them affordable, and getting them to the point where you can actually get high volume delivery efficiently and it doesn't have to cost the crazy amounts it does.
I know you've done a lot of work on the ground in India over the years, and work that's really made a difference to health on the ground. What surprised you about the response, both the initial response when they first found out about this disease, as well as where it's been going? And again, I know there have been big successes.
The striking thing about this pandemic is that if you looked at the rankings of who has the greatest pandemic preparedness in the world, the United States was number one on every ranking, and you would have seen places like India near the bottom. And instead, what you found was that the single most important factor was, do you have leadership that communicates a clear acceptance of the seriousness of the pandemic, mobilizes the public and the government to tackle the problem, and then uses whatever resources you have at hand to succeed. In the top 10 of performers were Vietnam, Thailand, India, as well as Australia and New Zealand. And that is all about political leadership. Turns out that, communications and organizing together allowed people to fight off the virus with basic tools like testing and simply wearing masks.
Is that also playing through in terms of anti-vax sentiment across those countries and our own?
Well, I think it's too early to say. There is hesitance, for example, in India about taking the vaccines related to the lack of actual trial knowledge, and you have doctors questioning whether they're ready to administer it. When you have, though, the profession coming behind transparent information about the safety and effectiveness of vaccines, we're seeing, fear being replaced with confidence in many populations around the world, including ours, where the number of people who are becoming unwilling to take the vaccine have dropped enormously, thanks to seeing neighbors, your healthcare professionals start receiving the vaccine and doing okay.